Signs of respiratory disease caused by HMPV virus in China. The Chinese Center for Disease Control and Prevention recently warned that the HMPV, human metapneumovirus, virus is a public health threat, especially with its ability to cause pneumonia and spread rapidly. Human metapneumovirus, HMPV, a common respiratory virus, is related to respiratory syncytial virus, RSV, both of which are members of the Pneumoviridae family. HMPV usually causes common cold-like symptoms, concentrated in the upper respiratory tract. Sometimes, it can invade the lower respiratory tract, causing pneumonia, which can worsen asthma or chronic obstructive pulmonary disease, COPD. HMPV is more common in winter and early spring. After being infected with human metapneumovirus, patients will usually show symptoms after about 3 to 5 days of incubation. These symptoms are quite similar to the common cold, including cough, nasal congestion, runny nose, sore throat, mild fever. The disease may then worsen and progress to lower respiratory tract infection with symptoms such as high fever, wheezing, cough with thick phlegm, difficulty breathing, pale skin. Signs of respiratory failure. Transmission of HMPV virus. HMPV virus is spread mainly through the respiratory tract and contact. Respiratory transmission. The virus can be spread through tiny droplets in the air when an infected person coughs, sneezes or talks. These droplets can contain HMPV and enter the respiratory tract of a healthy person. To prevent the spread of respiratory infections, you should cover your mouth and nose when coughing or sneezing. Wash your hands often with soap or hand sanitizer. Avoid close contact with sick people. Transmission by contact. HMPV can also be spread through direct contact with an infected person or contact with surfaces contaminated with the virus. For example, if you touch a doorknob, toy, or other object that has the virus on it and then touch your eyes, nose, or mouth, the virus can enter your body. Preventing HMPV infection. There is currently no vaccine to prevent HMPV infection. To protect yourself and your community from HMPV, take the following precautions. Personal hygiene. Wash your hands often. Wash your hands with soap and clean water for at least 20 seconds. Especially after coughing, sneezing, going to the toilet, before eating and after contact with sick people. Cover your mouth when coughing, sneezing. Use a tissue or your elbow to cover your mouth and nose when coughing or sneezing. Throw the used tissue in the trash and wash your hands thoroughly. Other measures. Keep a safe distance from sick people. Limit contact with crowds, especially during the epidemic season. Keep your living environment clean and airy. Wear a mask when going to public places or coming into contact with sick people. Strengthen your immune system with a proper diet, regular exercise and adequate rest. Thank you for watching the video. See you in the next videos.